Welcome everyone. Let me introduce myself. I am Rashid. From the National Company for Projects and Management SME Development Fund/SME Development Fund and Oman Academy of SME. Welcome to our presentation about health and safety in the workplace. My colleague Rima will continue with the coming slides.
Hi everyone, this is Rima, and this series will cover the topic of health and safety in the workplace. The series consists of 3 videos. Let's start with the first part and talk about first aid kits and CPR. Introduction. First aid, in a medical context, refers to the initial assistance or care given to a patient or injured individual at the scene of an accident before they are transported to a hospital, using the available resources. People are exposed to various accidents, some of which can be life-threatening. These accidents often require immediate intervention, especially in cases of fractures, fainting, heatstroke during extreme heat, nosebleeds, animal bites, and more. Therefore, proper training and prompt delivery of first aid can save lives. The importance of first aid. The presence of a first aid kit is essential in our daily lives and can be of great assistance at home, school, and work in emergency situations. Therefore, it should be readily available, including in your vehicle. Your priorities in an emergency situation should be: 1. Preserving the life of the injured person. 2. Preventing the occurrence of complications. 3. Speeding up the recovery of the injured person. 4. In case the patient is on a severe state, call emergency helpline. In Oman, the health emergency helpline is 9999. Conditions that must be met for the first aid kit. The first aid kit should be clean. Keep the kit in an organized manner. Regularly check the validity of medications. Clean and sterilize the tools after use. Disposable items should be discarded immediately after use. Moving on to the basic rules of first aid. Approach the injured person cautiously and calmly, ensuring no threats to your safety, such as proximity to an electric current or the risk of gas poisoning. Ask the injured person if they are okay. Call for emergency assistance, 9999, if necessary. Do not rush into providing aid until you've assessed the situation in terms of the number of casualties and the severity of their injuries. Rushing can lead to deterioration of the injured person's condition. Keep in mind that an injured person who cannot cry out may have more severe injuries. Cardiopulmonary resuscitation or CPR. It is a vital life-saving technique designed to revive the heart and restore breathing in an injured individual. The process involves 2 key actions: simultaneous mouth-to-mouth resuscitation and chest compressions to facilitate artificial respiration. Before commencing CPR, urgently call for help at 9999. Confirm that the person's heart has stopped beating and they are not breathing. Clear the person's mouth of any foreign objects, and position them on their back with a tilted head, ensuring airway patency. Start CPR by giving breaths and chest compressions every 5 seconds. Monitor pulse and breathing regularly, applying pressure to stop bleeding. In the case of fainting, follow the steps mentioned while promptly transporting the injured person to the nearest medical facility.